Health doesn't always shout. Sometimes it whispers. And if we don't pay attention, we might miss it. Welcome to Health Unfiltered, a series by Fullerton Health. Here, real people share the moment they choose to pause, check in, and take charge of their health. These are stories of courage, of early detection, and of lives changed not by symptoms, but by a single decision. Because behind every diagnosis is a voice, a family, a future, and a reminder that the best time to act is before it's too late. I'm your host, Veronica, and I invite you to listen, reflect, and be inspired. This is Health Unfiltered. Let's begin. Today, we are speaking with Dr. Navreet Pannu, an active woman in her 40s whose life took an unexpected turn when she was diagnosed with stage 1 breast cancer. She caught it early, through screening, before any symptoms appeared. Her story is a powerful reminder that one decision to get checked can save your life. Thank you for joining us today. Perhaps you could start by you sharing a little bit about yourself, your daily life, and your profession.
So I'm actually from Malaysia. I've been in Singapore for about 21 years now. I've been practicing in medicine since I came here. I've got 2 boys, they're twins, they're 18 years old this year. Generally, a very active person. I used to be a long distance runner. I'm active in Muay Thai, I'm a scuba diver. And I love reading.
And before your diagnosis, Dr. Navreet, did you feel any symptoms, any pain, or any parts of you that was uncomfortable?
No. If you're talking about days, weeks before, absolutely nothing.
Mm-hmm.
In fact, I just come back from a month holiday, like everything was so good.
Mm.
I didn't know anything until that one day I had a little bit of pain, which is actually very, very uncommon for breast cancer.
Yeah, I remember my mom used to tell me when we were young that when there's pain, it's probably okay, right?
That's what I've been telling my patients also.
Oh, that's
Yeah.
one of the things that you said to your patient.
Yeah.
And therefore that pain led you to do health screening, or was there something that
No.
prompted you to do it?
No, actually I do health screening regularly.
Mm-hmm.
And my health screening every year is due in mid-October. So this was early October when the pain came in. It started the night before. I ignored it. The entire day I was telling myself, it's probably nothing. You have your health screening coming up, so who cares?
Yeah.
But it was that day where I had a patient come back to me, and I had referred her for scans because of a lump. She was 40 years old and she was confirmed breast cancer. It was because of that something just started nagging at me to just bring it forward.
Okay.
So I decided to go for my scans on the same day itself. That evening after work, I went for the scans and it was confirmed.
And so you think the prompt by your patient, has actually helped you to kind of fast forward your health screening?
Yes.
And do you think if, let's say, you have delayed any longer, would the situation be a bit different for you?
If I had waited for that 2 weeks, no, I don't think it would have made that much of a difference. It's probably more mental than anything else. But had I waited for another year, maybe 2 years, maybe just thought, I'm fine, nothing's wrong with me, so things would have been very, very different.
So maybe share with us a little bit about what is the first thing that come to mind when you realized that you had breast cancer?
Honestly, nothing. I took it very easily. I mean, I won't say easily. I actually took it very well. There was a little part of me that was in shock, but basically at that point, I just had to continue in my treatment. I had to just continue the next steps and not think about it, not cry about it. So that's exactly what I did.
Has it got to do with because you're a doctor? That's
Probably,
why
yes.
You're more composed. You know what's coming. You know what to expect.
Yeah.
And do you think if such a situation happened to anybody else, it would be the same kind of reaction as you?
Honestly, I don't think so, because I've seen a lot of people who've gone through this and their reaction is very different. But then everyone takes this very differently. And honestly, it hit me more at the end after treatment was completed.
And maybe share with us also, what was the darkest moment for you? Was there something that kind of hit you even throughout the journey?
Throughout the journey, basically losing hair, losing my eyebrows, basically my physical appearance is changing. That wasn't very easy. And as I said, like coming from a very active background, not being able to walk for too long, getting tired very easily. I was very afraid of going out because of like chemotherapy and, you know, the risk of infections.
Yeah.
So like, that was also very difficult for me.
Mm-hmm.
And the hardest bit of my treatment was radiotherapy, because in most people, radiotherapy is actually quite easy. But in my case, because I've got very sensitive skin, I started burning up.
Yeah.
I mean, my skin burns were actually quite bad.
Okay.
So that was difficult.
Mm.
And having to do a lot of it on my own, because my parents are in Malaysia. My husband was traveling a lot at that point, and my kids were in exam year, so I didn't really want to disturb them too much.
Yeah.
So,
do you think the people around you, your loved ones, your family, your parents, your husband, and your children, were they affected by it? How did they react to the situation?
I mean, parents being parents, they took it badly. I know my husband did take it quite badly, but my kids were okay. They only had one question for me right at the start. Will you live? And because I was stage 1, I could confidently say yes.
Okay.
That was the only question they had. And once I said yes, it was okay.
Okay. And then you mentioned just now that it was hardest for you at the end of it. It hit you at the end of it. Take us through that moment when you were going through it.
Basically, you've spent the bulk of the last 3 months in and out of the oncology center. And the nurses, the onco team really become part of your family. You know, they're really helping you. Right now, you feel lost because like they're no longer there. I mean, they are there, but you know, you're not seeing them as often. Yeah. And right now, you have the time. Everything comes back, like what you went through in the last few months. It just comes back.
And going through this whole journey, right? Has your perspective in life, in health changed?
Perspective in health, probably not so much, because I really had no way of preventing this. But perspective of life, yes. I don't stand back anymore. If there's something I want to do, I do it.
Yeah.
I've always wanted to do dragon boating.
Oh, okay.
But I never had the courage. Now I do it.
You have done it recently?
I've been doing it. I've joined the Breast Cancer Foundation, and I dragon boat with them.
Oh, interesting.
So if there's something I want to do, I do it now. I don't wait.
Live for the moment.
Yes. But the other thing is I do listen to my body now. If I'm tired, I'll take a day off.
That sounds like a very good advice for all of us who are so busy all the time at work. You seem like a very, very strong woman, very composed, very focused on your treatment. If you're not a doctor, do you think you would have gone through this very differently?
Probably I would have, yes. Yeah.
Did you cry throughout this journey? With your husband, with your
children?
Only
At the end.
Only at the end?
Only at the end.
Tell us a little bit about the end for you.
Like I said, the end was basically, I realized that I was on my own now. And a lot of people expect you to, you know, it's over, get back to normal. But normal has changed.
Okay.
So you don't even know who you are anymore.
Really?
So you got to like redo like things. You know, you have to actually get to know yourself again. Okay. What can I do? What can't I do? I mean, I realize there's a lot of things I can do now that I was doing before. Yeah. But at a slightly lower level. It's going to take time before I hit that again. I mean, I can't go out and do an ultra marathon right now. But hey, I can run 5 kilometers. That's fine.
When you were going through this, right, were you worried about anybody or anything in your life?
I would say more my husband. Because he had a lot of, he's seen a lot of cancer in his side of the family. And at that particular time when I was going through this, his dad wasn't doing very well. He passed away eventually during my treatment.
Do you have any family history of breast cancer?
None at all.
So
Zero.
It can hit anyone?
Yes, that's why. I mean, like in practice and in my interaction with the Cancer Foundation, I've realized that most breast cancer have no family history. So that's why it does upset me a little bit when patients say I don't need to do a mammogram because I have no family history. Like I didn't have family history, and I know a lot of women did not have family history too.
Yeah. And do you think if, let's say, you had delayed any longer, what do you think the outcomes would have been for you? Number
one, I could not have given that promise to my son. That was the worst thing. Secondly, the treatment would have been a lot worse. In my case, I sailed through chemotherapy actually with very little side effects. I had no nausea, no vomiting. I had a very big appetite. I was eating a lot actually.
That's good.
Except for the tiredness, I really had nothing to complain about, and the hair loss, obviously. But if I had waited, if I had delayed treatment and waited till I reached stage 3, stage 4, treatment would have been very different. It would have been horrible. Not just for me, on my kids, on my husband,
If there's one thing that you want to share with people who are listening to this story of yours, what would that be?
So go for your health screening. Don't rely on your family history. Don't wait for the symptoms. Just go for your health screening once every year. Do it for yourself. Do it for your family. I mean, the rest of the year, as long as everything's normal, you've got that peace of mind. They have the peace of mind. Just do it.
Being a doctor yourself, do you think it's any different for you navigating through the journey versus somebody that is not a doctor?
Yeah, I had a huge part of it because to start with, being a doctor, the radiologist was a colleague of mine. And so I had like first-hand experience with her. She's talking to me, she's showing me my scans, explaining what everything was. And then she referred me to like someone she knew. So basically my entire referral was basically through word of mouth. I mean, like friends, colleagues and all. So I could understand what my oncologist told me. I could understand everything, like when she said stage 1, I'm like, all right, so I know what stage 1 is. I don't need to worry. What's next? She explained the chemo plans. I'm like, okay, that's not too bad. What are the side effects? The problem with other people is the moment you mention chemotherapy, all they think about is nausea, vomiting, losing weight, losing hair. But it's not like that for everyone. So it helped that I actually knew the medications. It helped that I knew the doctors. And it also helped that I don't rely on Google. That's another big problem which a lot of people do. So Google will really scare you.
Yeah.
So that's the reason why I was actually very calm, because I actually understood the impact of every step. So I could understand, okay, yeah, all right, 12 weeks of chemotherapy, what next? I could actually understand the treatment plan very well. I knew what was happening, and I knew the questions I could ask my oncologist and my cancer team. So a lot of people, they are just thrown a lot of information and they don't know what to ask. They don't know what to think of. And when they go back, when they're trying to digest the information, it's just way too much.
Yeah. Can we just talk a little bit about the work that you do in Breast Cancer Foundation?
In Breast Cancer Foundation, I'm a member there. So I attend support group meetings. Initially, it was actually very good to hear from other survivors. And yes, the initial dread, how long do I have? It's always there. And you go there, you're meeting women who are 20, 30 years survivors who were diagnosed far worse than I was.
Yeah.
It gives you hope. So now those who are coming in, if they need help, if they need someone to talk to, I'm there for them.
Why do you think the incidence in Singapore for breast cancer is so high, 1 in 13?
It's environmental. A lot of, this is my personal thing. Hormones is number one. A lot of our food is pumped with hormones. A lot of women are on long-term hormone treatment. IVF has gone up, and that's very high hormones there too. Plastic bottles. A lot of us used to keep plastic bottles in the car, which melts into, So it's alcohol intake is the other one, which has increased. So alcohol causes breast cancer. Not exercising, sedentary lifestyle. Exercise is a proven prevention for breast cancer.
So if, let's say, there's any lady in Singapore that may be very fearful of knowing the truth, that it's too busy to want to take care of herself, what is one message you want to leave with the audience?
If you're going to get it, there's absolutely nothing you can do. If it's really going to happen, there's nothing you can do. You do want to find out when it's stage 0, stage 1. You don't want to find out when it's stage 4. It's not too late. It's still treatable, but the treatment is going to be awful. And remember, as I always say, the toll on your family members is horrible.
Yeah.
You don't want to do that.
Thank you very much, Dr. Navreet, for sharing your story with us. I think it helps a lot of us to kind of realize how important it is that we take care of ourselves before we can take care of our loved ones, right?
Yeah.
Thank you.
Thanks for having me.
She was healthy, she was active, without any symptom. One mammogram, inspired by another woman's story, gave her a second chance at life. Now she's paying it forward through a foundation that uplifts others. This is the silent face of early cancer and the power of proactive screening. This is Health Unfiltered, Thank you for watching.